Hey there, and welcome to Lunchtime Live with the Center, where we talk about important fertility topics related to your fertility journey to support and inform your fertility journey. My name is Ami Choksi, and I'm your host. When you make a first appointment, when you decide to come to the center, you likely want to know what to expect, especially in the current environment with COVID. So today we're here with Dr. David Schmidt, who is a lead physician here at the center, as well as an assistant professor at the Yukon Health Center. And he was also recently awarded the Hope After Loss Compassionate Care Award for 2020, which is well deserved for anyone who knows him. Dr. Schmidt is going to help us demystify what to expect from your first appointment and what it looks like, how to prepare, and he's going to take your questions as well. So, Dr. Schmidt, welcome.
Thank you very much, Ami. Happy to be here.
Yeah. So, first of all, could you talk a little bit about how someone would schedule an appointment with us?
Sure. It's very convenient right now. We're all dealing with the difficult pandemic. At first, it was perceived as a barrier to seek medical care and infertility evaluation, but we've actually made it very approachable for patients. We're doing a lot of initial consultations online and virtually, and patients have actually found it more convenient, more accessible. The appointment is still scheduled in the same manner, but then we can connect to them online via smartphone or home computer. We do ask that patients just prep ahead of time. We have them download a program called Microsoft Teams, and then they can converse with us in a secure manner with that privacy and HIPAA compliance in effect, and talk with us and start the evaluation.
Okay, great. So it's really convenient that way.
It really is. And, as far as preparation for that first visit, we're still asking patients to do their homework a little bit, try to get as much of the records from their referring physician or their primary OBGYN to us ahead of time. That helps us. We review those records and can streamline the initial visit. And what to expect with that first visit, they will usually speak with the physician initially, and during that 1 hour appointment, they'll also be speaking with the physician's primary nurse and the financial counselor as well.
Oh, okay. And before the exam, do they need to do blood work? Is there any preparation before the first appointment? That it would be telehealth, is what you're saying?
Right, that's right. We're doing primarily the video telemedicine conferencing because you get a chance to see us face to face, and we feel it's a little bit more personable than a telephone call. But if for some reason a patient cannot use the video link or telemedicine, then we can schedule a phone consultation as well. As far as the preparation ahead of time, primarily getting any kind of previous tests, laboratory results, ultrasounds that have been done already, getting those records to us is helpful. There's not really a requirement to do any testing ordered by us prior to that first visit, because we may tailor the testing, blood tests, ultrasounds, and certain tests based on a patient's personal situation or history. So there isn't a requirement to do testing before the visit, but certainly if they have had any testing done, we certainly want to get those results to our office so we can review them beforehand.
So in this first appointment, you're reviewing, well, are you reviewing their past history? And is that what's happening?
That's right. So we would like to review the records and of any previous testing ahead of time, and the history from their referring physician is helpful if we read through those notes. But then we will meet with them one-on-one and talk through their history, get a sense of their personal goals, aspirations for family building. Some patients are referred for infertility, some are referred for recurrent miscarriages, and we have other patients referred for other issues, and reproductive endocrine issues or endometriosis or malformations of the uterus. So we do a wide range of treatments and assessments. So we want to be able to talk with the patient individually,
Okay.
and understand what their concerns are and what their goals are. And then afterward, usually they'll have a follow-up phone call from one of our primary nurses to take them through the logistics of help them through that process. We may need to order certain laboratory tests on a certain day of their cycle. We usually schedule an ultrasound so we can look at the patient's uterus and ovaries. And we may also do a test where we can check the fallopian tubes. And we try to streamline those appointments to have them on the same day. But it can be overwhelming at the first visit. So we like to have the patient have a chance to meet with the physician primarily and first. And then the nurse will also establish contact and a means of communication and set up those appointments.
Okay. And you said that they're meeting with 3 people in this environment, in this telehealth call. Are they all on at the same time? How does that work?
We stagger them. We at first, we used to have the history taken by our nurse with the patient, with new patients that we were seeing. But with the telemedicine, we thought it would be best if they got a chance to speak with the physician first, and review their history and their concerns. But then on the tail end of that visit, after we've answered all their questions, the nurse will talk with them subsequently. So they're not all on at the same time, but it's an hour total time frame with the physician speaking with the patient, then the nurse kind of helping through the logistics and some follow-up medical questions on how do I do this or where do I go. And the nurse will also not only answer their questions, but help schedule those appointments.
Okay.
And then finally, we have our financial representatives help them through navigate through some of the difficulties with insurance and if there's any costs or co-pays involved. And really, the patient should know that they're really there to help them, because many medical offices do not have any financial representatives or aides to help through that process. And it can be really overwhelming with today's, co-insurance or co-payments, deductible plans. And they will help not only find out if there's coverage for the testing and treatment, but they will also often pre-authorize any of these treatments and tests that we order.
Oh, okay, great. So you're covering a lot during this time. That's, what should patients come in with questions for you during this time as well?
Yeah, that's a great question. Oh, I think we're getting some questions now as we speak. Look at this.
A lot of favorable comments too.
So to answer your question about should patients have questions? Yes, we do. We do encourage patients to write down their questions. We're in this day and age, we have limited time. Physicians have less time to be with patients, and there are more demands and time constraints. But we really do feel like we set aside enough time to answer every patient's questions, concerns, and needs. But it helps the efficiency of the visit if you have specific questions for us to go ahead and write that down. There's ample time to answer those questions. And then we also try to establish an open line of communication, because often patients will have questions after the visit or as they do some tests or they think of things down the line a week later. We encourage them to call us. We all have primary nurses on our team that are the go-between the patient and the physician, because obviously we're busy all day long seeing patients and doing surgery. So if somebody's calling into the office, we might not be able to break away, and it's not fair to the patient that we're with at that time to go and take a phone call. But our nurses work very closely with each physician and the financial team. So if there are any questions at any time, patients are encouraged to call. We get the appropriate information and answer back to them, usually the same day or the next day.
Okay. And what about partners? Now, can they be a part of this, and could they be a part of it from a different location now that it's telehealth?
Absolutely. And, we worked through some of the IT challenges when when we first dealt with COVID back in March. Our IT team has really been great, and they've set up a secure link for not only the patient and the provider, but also the partner. So it is a unique, secure link. So that's why we make sure for this to work well, you have to log on ahead of time, make sure you download the program, but it's fairly seamless. We have instructions on the link, but if you download it ahead of time on each device, whether it's a smartphone or a computer, both the patient and the partner can log in individually. They don't have to be at the same place. And I've had patients that love it. One might be at work, one might be at home. I've had patients and their partners both be at work, and they'll go out to their car on a break or in a closet and say, "Shh, nobody's around, but don't speak too quietly." And I say, "I'll pretend to be the electrician. Don't worry about it."
It makes it really convenient.
But it is convenient, so everybody can log in and interact. And at the same time, it's not required that partners be present. So if a patient needs to schedule an appointment with us and their partner might not be available, we don't want you to feel as though you have to have your partner there in order for us to start the evaluation. They're welcome to come in at any time for subsequent visits. So, we don't want you to feel like you have to delay that appointment another month or so, because sometimes, especially today, it's challenging with everybody's work schedules and where they are. But it's more convenient and more accessible now that you can log in essentially from anywhere you have internet service.
And do you know how long it takes to actually make an appointment with us, as far as, like, is there a lead time?
That's a great question. I don't want to say specifically without knowing the exact timeline, but we do our best to get patients in as quickly as possible. And we have 6 attending physicians and 3 nurse practitioners here, so we do our best to get you in fairly quickly. It's usually anywhere from 2 to 6 weeks. So within a month or a cycle, we can usually fit people in for a new visit.
Okay. And so are all of the visits virtual now? How have things changed with
Oh,
COVID?
great. And a follow-up answer to your other one. Once you're seen by us, we do try to get you through the process of evaluation. And if you need treatments or surgeries, we try to do that as quickly as possible, because we understand patients may have been trying to build a family for years before they even see us. So we understand the timeline and the importance of that. At the same time, to do the proper evaluation and testing does require some time. So we don't want to rush through the evaluation and make recommendations without all the information. So that's why, again, it's helpful if you've had testing done already, please send that in ahead of time so we can review it. And then we'll do our best to get you in as quickly as possible. And usually subsequent visits are pretty quick. We can see you, follow up once you've established that initial visit. You're now a patient of the center, and we see you quickly. So your last question, sorry.
Oh, yeah. Are all of the visits virtual, or what's virtual versus what's not?
Right. So in order to comply with current CDC guidelines, and ASRM is our American Society for Reproductive Medicine, they're still and the Connecticut Department of Public Health, they're still requiring us to do some remote consultations by virtual telemedicine. But I reassure our patients that we have always been in the office daily, seeing patients every day for essential visits. So we are here. And if a patient ever needs to be seen, just contact the office. We will bring them in. And then obviously physical exams and ultrasounds and certain tests require that we're seeing the patient in the office. And so those are scheduled, as well as the consultations remotely. Both are happening every day throughout the week.
Oh, okay. So you have a lot of comments here, but they're all about you being the best doctor ever. So,
Oh,
Team Schmidt. Hi, Dr. Schmidt. Can't say enough about this group. He gave us 2 girls. Dr. Schmidt, you're the best. This office is wonderful, and so is Dr. Schmidt. So lucky to work with Dr. Schmidt. So you have people who work with you who are watching you.
I pay them a lot of money and buy them coffee to say that. No, I'm just kidding. Well, thank you. And I know people's names aren't necessarily out there, or are they?
Yeah,
I don't want to.
they are.
But thank you all for your nice comments. I really appreciate it.
For the new patients that are in line, waiting to come to see you, what advice would you give them? Is there anything specific that comes to mind when you see a new patient?
Let me just see. Yes, I'm trying to get. I have a pop up here on my screen that I was trying to get rid of. There we go. It's telling me to wear a mask at all times. So, except for when I'm on TV. So, advice to patients, the advice for new patients coming to us?
Yeah, I mean, these are women who are nervous, a little anxious about getting started, don't know what to expect. Anything that comes to mind?
Well, I think you'll find for new patients, they might have some apprehension and anxiety coming to a new office, but we want you to know that not only are we board certified OBGYNs, but we're board certified in this subspecialty of reproductive endocrinology and fertility. So we're, we're aware of what you're going through and we're sensitive to it. I think once you start here, you'll find that we are very caring physicians and nurses and providers, and we all agree this is a wonderful place to work. I'm blessed to have a great team of nurses and partners, other physicians that I would send any family member to as well. So I think that's the other thing. You don't necessarily have to wait for a certain provider. We have 6 attending physicians and 3 nurse practitioners here, and we all collaborate and communicate with each other. So I think you'll get great care from any of us here, and we work as a team. But then we also try to maintain that personal relationship with the patient, so they feel that they can turn to a well-known physician or nurse and have that continuity. So as far as advice before coming here, I think just, trust us, be open with us about what your concerns, your anxieties are, and what your goals are for family building. And we'll make sure we communicate well with you, give you excellent care. We have fantastic success rates here at the center on a national level. And we feel good about all the couples that we help and all the individuals that we help have children.
Okay, wonderful. There is one question. Gabrielle says, after starting there, does the patient continue even after pregnancy with you guys?
Oh, that's a great question. So because we are OBGYNs as well, we are able to follow patients early in pregnancy. We tend not to follow them beyond the first trimester, only because your referring OBGYN at that point would start routine prenatal care. And that tends to be both in terms of medical malpractice, but also board certification. And OB care tends to be global care, and it includes, your first visit at about 9 or 10 weeks onward through delivery and the postpartum time frame. So it's a nice collaborative effort, though, that we're not taking you away from your referring primary OBGYN. We're working with them, so to speak, as specialists and consultants. But while you're here under our care, we will take care of pretty much everything and anything and everything. We still encourage you to see your primary OBGYN for annual visits and routine care, but then at the same time, we're keeping them updated. So as soon as you are pregnant, we will continue to see you early on in the pregnancy to the point where we'll establish that the pregnancy has a good heartbeat, it's in the right location, it's not an ectopic pregnancy, it's not an early miscarriage. And then to a point where we feel that the pregnancy looks good and is healthy, and then we'll send you back to your OBGYN. We, of course, want to stay updated. We don't want to just lose you and lose you that personal connection. So we ask that you update us, but you would be back to your OBGYN usually at about 9 or 10 weeks is your first visit with your OBGYN, and we would follow you until you've established care. So that we usually send you back to set up that first prenatal visit after a good ultrasound with a reassuring heartbeat. And that's done in our office at about 6.5 to 7.5 weeks. But certainly if you have any concerns or you need to be seen and you haven't been seen by your OBGYN yet at that first visit, we are here every day and can see you.
Okay, great. There's one more question. If you go in knowing that you want to use donor sperm, is that something that's good to know at the first visit? And does it change how you approach something?
No, that's obviously an important part of the history. So when you're booking the appointment, you can let the staff know, what you think you need or what the issues are, and that helps us prepare on our end. If we know that you're going to need donor sperm or donor eggs or a gestational carrier, any of that, that's important because we have additional information that we want to send out to you before your visit, so you have a chance to review that. And there are maybe some other different testing or other prerequisites that we might need to educate you about and spend time talking to you about. So it's certainly important for us to know that, but you don't necessarily have to do any other testing or other. It's not a different approach in the way that we interact with you. We are going to, of course, give you different information if you're utilizing donor sperm or donor egg and help counsel you about that, but we want to answer your questions appropriately.
Excellent. Okay. Last comment was, thank you, Dr. Schmidt and Kathy. Our family has grown by 2 with his help and expertise. All the best.
Aww.
Yeah. Can I switch gears and ask you a couple of more personal questions?
No, never. Sure.
Okay. What is your favorite season and why?
Boy. Well, I grew up here in Connecticut and went to undergraduate in upstate New York. I've always lived in the Northeast. I've traveled all over the country and to Europe. But I love New England and the Northeast for the fact that we have all 4 seasons. So I really honestly enjoy all seasons. I used to ski quite a bit with ski patrol and raced, and I love the summertime. Fall is beautiful here in New England, but I would say spring is my favorite time of year. If my mother's out there, her birthday's in spring and she loves spring. So she'll say you're a good son for saying that. But I really do love the spring weather. The flowers, the weather is beautiful, the sunshine, and it's really a time that life is blossoming, and that's probably appropriate for our field. So spring is my favorite season.
Okay. What do you like to do outside of work for fun?
I love to spend time with my family. I'm blessed with 2 children. My daughter's 13, my son's 11. My wonderful wife is also a partner here, Dr. DeLuigi. She's at the Hartford office. So I think I see her more at work than at home, but that's okay. So we really like to spend time with the kids, and we're busy here at the practice. It takes a lot of our time, but when we're not at work, we like to spend time as a family doing pretty much activities that our kids love to do, but that's very rewarding. And that's, I think we relish families and children with what we do. And so we try to spend as much time together as a family outside of work.
And finally, what is the best piece of advice you've ever received?
I would say it has to stem back to my kindergarten teacher. always be kind. And I think that is really important in life. We're in some challenging times with the pandemic and political disagreements. And I think, we're a civil society and especially in our field and trying to help people of all walks of life build families. I think it's important to have compassion and kindness, and no matter what we do, even if people have difference of opinions and different perspectives on life and different backgrounds, we all want to help people build a family and achieve those goals. And it's important to have kindness and compassion in life as we do it.
Well, you definitely exemplify kindness.
Oh, thank you.
All right, Dr. Schmidt, I know you have patients coming up. It's always a pleasure speaking with you.
Thank you so much, Ami. And thank you to everybody who participated, the kind words. And for those of you who don't know us, please don't hesitate to call us and make an appointment or just talk with us. And we're here to help.
Yeah. All right. Well, we'll be back next week with another Lunchtime Live. And be sure to check out our website, yukonfertility.com, for additional information and a calendar of events to support and help you feel connected. So see you next week.